from Dr. Neil Secrist, board certified in family emergency medicine. He's the author of Doctor Speak Out. You can listen to Dr. Neil on pgdnews.com. Click on Doctor Speak Out. So at this time, let me introduce Dr. Neil Secrist.
Jim, thanks. You know, I sat in the audience at our national summit, the annual summit we had a few weeks back, and I was very impressed to see the pilot program they launched out with the transformation program, which I hope you can talk about shortly at some point. Basically, they put 100 people through a proven plan, and it's a 13-week plan, and in that time, 100 people, 100%, in other words, all 100 of the participants transformed their lives from the inside out, primarily with the blood work, then their bodies, and, of course, their mentation, and they just improve and are reaching things that they've never done in their lives before. 3 of those were my patients. I sat in the audience and watched it. I was so impressed that my wife and I immediately enrolled in that program. We're now into our second week, and I'm already down to 2 or 3 pounds additionally from where I was before, which is really a fairly decent state. But it comes back to the product. That's what is the cornerstone of this whole thing as it relates to health, as it relates to our business, and quite frankly, as it relates to people's lives. So we're looking at a clinically proven, safe, and effective product. Clinically proven because there's plenty of studies out there that shows exactly how well this has done. Major universities across the globe, Cleveland Clinic, Stanford University, University of Sydney in Australia. I mean, the list goes on. We find it in our physician's desk reference, which is a very reassuring and comforting type of documentation that many of the medical professionals learn to know and trust over the years and to use. And so the key benefits very quickly on the slide are it's improving cholesterol numbers. So what that means is it's increasing good cholesterol, not just by a little bit, but by up to 29% in the studies. It's decreasing bad cholesterol, again, not just by a little bit, but up to 31% in the clinical studies. And it's lowering triglycerides between 40 and 80% according to the clinical studies. But in reality, what I see in my practice, oftentimes those numbers can be even better. In fact, many of the triglyceride drops are over 100% reduction in their people's triglycerides, depending on how bad they are. So this product works. Because it works so well with cholesterol and how it's put together, number 2, it's improving diabetes and prediabetes. Well, what's interesting is that statistic you gave us earlier, about 75% of the population being overweight within the next 8 years. Well, they're projecting that to be 90% by 2030. And that means 9 out of 10 people are going to be overweight. Well, diabetes is a weight-related illness. And so here you have something to deal not just with the diabetes, but the cause of the weight, shedding the extra fat. So the latest version of Slim, which you see on the slide there, Slim G, is extremely effective in balancing out blood sugars, reducing appetite and cravings, and rescue eating. It's so effective that even within a couple of doses, people can watch their blood sugars go down significantly, just like you have on the slide there. In fact, what we're seeing is that because this is put together so well that many people, for example, diabetics who are on insulin, many are just on pills, but those who are on insulin, they're reducing their diabetes their insulin use by as much as 40% in the first 7 days. Why? Well, because that product, here again clearly outlined in the University of Sydney in Australia, is proven to reduce the glycemic index of the actual meal itself by up to 30% with each and every meal. It fills you up. It's sweetened with stevia, very friendly sweetener out there. It's a non-fermentable type of fiber. It is gluten-free. And what's fascinating about how well this whole thing works is, it's just helping people with so many issues. Everything from all around the GI tract to gastritis and irritable bowel issues, all the way through the blood issues, cholesterol and diabetes. It's helping people lower their chance of heart disease. So it's a fantastic formula, totally safe in nursing, pregnancy. We can use it in our children, and, our kids are getting bigger these days more than ever before. So here's a great solution for kids to be able to simply mix it up and take it before their meal. So I'm very impressed with it. We have now basically over 1,000 patients on it over the years. It's no wonder that so many top-name physicians, prime cardiologists, internists, endocrinologists, family physicians, nurse practitioners, healthcare providers, really from all different walks of life, are enjoying these options to offer as their patients, as the patients need it for all those so many things: cholesterol, blood pressure, diabetes, metabolic syndrome, PCOS. I mean, insulin resistance of all kind, and quite frankly, just wanting to shed the extra pounds and inches. So, very impressed with that. It works great. I wouldn't know where to stop. I'm telling you, we've got a real home run here, Jim. Let me offer you a quick announcement, too, as the slide talks about. So many people, because of being in that overweight status, are really high in their insulin in their system. They have insulin resistance. They're trying to overcome that. That insulin is very fatiguing, and so it's no wonder that so many people are feeling tired and draggy and fatigued. And it's not just due to increasing age, because there's plenty of older people that have a lot more energy than maybe some of my younger patients, and the reason is they don't have the insulin resistance. So here's a great formula that people can use to improve their health, yet it's not any kind of a stimulant or an energy drink. The $10 billion a year is being spent on energy drinks because people are so tired. What a great breath of fresh air that the BioSlife brand has added matcha, replacing the BioSlife E in name only. Benefits are far beyond energy, as you clearly see on the slide. It is increasing energy through a natural way. Now, there's no sugar or stimulants in it in any way, shape, or form. It's simply a natural form of energy. It's a Japanese ceremonial-grade green tea. It's grown in the shade, hand-picked in only a few days out of the year, and it's stone ground, so you get the entire leaf. The key for matcha is you get the entire leaf and brew it. So it's actually a suspension that turns green because it's so potent. In fact, 1 cup of matcha, Jim, has the equivalent of the 10 cups of regular green tea, primarily because it's so laced with those strong antioxidants. It restores the electrolytes, increasing metabolism, has mild thermogenic properties to it. What an excellent complement to Slim, BioSlife Slim, BioSlife Sli, and quite frankly, the top-selling BioSlife Slim G. So we're going to focus on Slim in the rest of our presentations, but this is a nice adjunct that is accelerating the results, and it leads into our transformation program. So turn it back over to you, Jim.
Hey, Dr. Neal, thanks a lot there. I want to keep you on for just another second here as we go into announcement number 3 with the transformation program, as you mentioned. 100% results. It's a 13-week program where you actually we can let Unicity work with you with a coaching program, a personal coach, a trainer, a fitness program tailor-made for you, world-class nutritional products, support, your website. You keep track of everything. In 13 weeks, folks, it'll change your life forever. And, of course, we have the different ways of coming in as a manager, junior manager, client, or existing franchise owners. But, Dr. Neal, I want to have you come on here and just talk about the numbers here as part of the program here, because we know numbers don't lie. From the blood work on the inside out, we'll use Cheryl's transformation, as we can see with the before and after, but maybe you could explain her results in 13 weeks as one of those 100 folks that were in the trial there that had 100% results.
Sure will. It's interesting because I had never seen these blood results before, and they kind of invited me up on stage and kind of threw me out there and said, okay, what do you think? Put me to think on the spot, thinking on my feet. Well, I guess I do that in emergency medicine anyhow, so it wasn't too difficult. But if we look at week 1 from Cheryl, here you got somebody that's got a total cholesterol that is over, quite frankly, 170 to 200, which is a problem. Her HDL is really, although it's green, it's not acceptable for a gender. Males need to have 40, females need to have 50. So her LDL cholesterol there, 116, that should be less than 100. Triglycerides should be less than 150, so they're twice as high as they need to be. And her fasting glucose, quite frankly, if that's the way that really is, and that is at a range, or A1C reflects that should be less than 6 if possible. And of course, her blood pressure is stage 1 hypertension, so she's carrying around too much fat. And but she's not alone. This is the problem that we have in America. This is very typical, and I mean North America as well as the world, this kind of blood issue. So, and in 13 weeks, look what we've seen happen here, a normalization of those cholesterol numbers. Her HDL did not drop. Oftentimes that costs you HDL when you improve your LDL. But I'll tell you what, here I expect that to rise over time. So her LDL dropped nicely, that bad cholesterol, triglycerides, wow. That's over a 200-point drop in those triglycerides. Her blood sugar came down very nicely. I expect that to reduce with time. Look at her blood pressure, reduced totally normal. So if I look at the red box, I would probably give this person at least 1, 2, possibly even 3 medications to help deal with this if I only had a pharmaceutical option to do it. But by offering her the transformation program and her succeeding in that, she focused on the underlying cause. They focused on healing and getting rid of the cause for these. She doesn't need any medications now on those numbers. I think those are fabulous results, Jim. I'm very impressed, and that's what's got me so excited about it, to offer it to everybody that I know, and that's why I'm personally doing it myself.
Well, Dr. Neal, thank you so much for explaining. You know, we have that saying, numbers don't lie, and folks, when you sign up for the transformation to change your life for 13 weeks there, with your coach, your personal coach, who will call you and work with you, you know, get that accountability and really support you, and then do a tailor-made fitness program for you. I mean, how much does a personal trainer cost at the gym? It's worth it right there. And they tailor-make that according to where you're at, no matter if you're young or old or whatever your situation is. It really works. So this is a 13-week program, and folks, we're going to show you when we come to the compensation plan in a little bit here how you can get your transformation 13-week program paid for free by